And you'll do this with clients all day long. You're like, decide you want me to work on, put it up. And they're like, huh? I'm like, is your right side the problem? They're like, yes. I'm like, lay on your left side. Yeah. Something like that.
Kick you in your forehead.
Yeah. Why are you kicking people in the forehead? You're being all violent over here.
I can get my foot that
being all violent. I'm going to scoot that over just in case. And then for you, is it always up here?
Oh, shit, yeah.
Is that too much?
No.
Not too much?
Surprising.
It's not bruised.
And then were you asking, I think you mentioned it, more like between the shoulder blades. So, and let's point this out. When people are having problems like the rhomboids, between the shoulder blades, rhomboid major, rhomboid minor.
It's like everybody.
Why are they having problems here?
Desk.
This is a trick question from yesterday.
Because I'm slouching?
Is it the slouching going
Yes.
forward?
So in my world, what I think happens, and it's not because, so in other words, she comes in and tells me it hurts between my shoulder blades. Do I want to be like, no it doesn't. I'm a man and I know better.
Oh.
I'm well trained. Exactly. Women love when I interact with them this way. I'm a man, I know better. I'm well trained in anatomy. You're actually having a problem with your pectoralis major and minor. It's pulling your shoulder blades forward. The rhomboids are actually weak. I am intellectually superior. Well, but it's attitude, right? But it's attitude. If I say, hey, listen, you're having some tightness through here? Cool. Does it just feel like between the shoulder blades, or is it like more when I get to the spine?
Spine.
More to the spine?
Yeah.
Okay, cool. If I grab you here and then kind of roll you back, how's that? Because now what she feels is I'm addressing the thing she came in for, but when I start to pull her back, what am I doing? I use that to my advantage. Once I've established some contact or rapport with the client, then that's when I would slide off the shoe. Remember this guy? I came in, I go, hey, right there. Cool, a little higher. A little higher. Oh yeah. Now what happens if I do this? There we go. So when I lengthen that muscle, and this is something we didn't bring up yesterday. Remember we talked about the skin stretch and like the various directions? Is lengthening or stretching or mobilizing a less effective technique than the skin stretch? So if we have 5 different techniques, which one do we use? One, and then what's most effective for the client? And they're like, well, I don't know. And I'm like, yes, you have to communicate with the client and give her the technique that's going to work best for her. So in very rapid succession, I go, okay, do you prefer the pressure or do you prefer this? She prefers the pressure. How's that right? Now, if I give you pressure and rock, how's that? That's really good. Cool. She just told me. I don't have to intuit anything. I didn't have to meditate, breathe, go inside, have a deep thought about my chakras and the energy unwinding through my nervous system. All I had to do was ask her, hey, how's that feel? And she's like, that's better. I'm like, cool, let's do that. And is it all the way up here? Okay. And in my case, because she wants a little pressure there, I'm gonna come around. And this is completely improvising based on what she's telling me. And you want more pressure in there? Okay, cool. So I'll slide off that shoe again because I was trying to figure out where she was at. Coming right. Is that too close to your spine?
No, that's it.
Okay. Now, is it better when I traction your arm down?
Yeah, it takes less.
And a little to the back?
Yeah.
There we go. Is this still opening, pec minor, pec major, lengthening? No, do you like a little rock there? Yep.
So you can feel that.
Yep.
No, like, I guess kind of at the top of them.
Do you ever have pain in your shoulder?
It pops all the time.
Okay.
Yeah.
Then you have pain like down the shoulder blade. If you went to the lower section of your shoulder blade, it's like an oval right here.
Like pain?
Yeah.
No, I don't really
No?
get pain. It's
Okay.
mostly effort.
Right there. Now, would you prefer this tool or would you prefer me use my forearm and elbow?
The other tool.
The other tool, meaning this one. You want more pressure? Now, If I take pressure off, that's me taking pressure off. It's imperceptible. I don't think you can even see it. Now, need more pressure?
I mean, it's not bad.
More to the front?
Oh, yeah.
Or more to the back?
Front.
Tell me when. There we go. How's that?
Yeah.
In my case, I think it's important to touch the spot that the client came in for. They say it hurts here. Like, I just want to make sure the client feels heard, because if I go to a different area, like let's say I just did the thing, remember we started yesterday where you traction the arm back and over? My body wasn't quite so close to them, it was a little more distal. I just need to make sure they feel heard, and then I'm actually listening to them to work on that area, right? There? And I go, hey, what happens if I make little circles? How's that? Oh, that's nice. And she told me, I didn't have to guess. Oh, that's nice, she wanted that. Now, if I back off of here, and then you were asking about neck as well, right? Okay. So I think it already starts to address the neck because it's getting levator scapula. Getting levator scapula means it's attaching at the top of the shoulder blade. Levator, scapula, elevates the shoulder blade, elevates the scapula, right? And it goes up into is it the first 4 cervical vertebrae? Do you guys know? It's I don't either. I go look it up on Google. I teach the shit. I don't know. So I just go look it up. So it attaches up in here, but all of these muscles. Do you prefer lower or higher?
Lower.
Lower. Tell me where.
Right there.
Right there. Cool. So I'm gonna come in from this side because I'm already facing this way and I can see you guys. I'm gonna come over and try to make myself comfortable. I'll slide this shoe off so I can sit. And then I'm trying to figure out how I can stack. How's this right here? How's that right there? Okay. What happens if I pull your shoulder blade back? Okay. Now forward or back?
Forward.
Tell me when.
There.
Cool. Down?
Yeah.
There we go. How's that? Ow, shit. Is it too much?
No. I don't think I can take it.
Put my elbow up.
You don't think you can take more? Okay, then you back off. Okay. Now, could I do this with the other forearm? Yes. Having my left in and then capacity to do this also allows me to traction the arm. So I'm gonna change it just for a second. I'm gonna grab here. How's that? Okay, cool. To the back or to the front?
Right.
Okay, right there?
Yeah.
And then still down towards the elbows, good?
Yeah.
Cool. Any referred pain from this, or is it just tender?
Just
Now, a little more up, a little more down.
down.
And to the back, or the front? Front. Right there. I can feel when tissue feels like dense, tense, and tight. 9 times out of 10, that's kind of where you're going. You guys know this, you work on bodies every day. But I also just ask periodically, especially if it's chronic pain stuff or something that's really bothering them. That shear, that skin stretch is huge. When I would just do this and go, oh, it's dense right there. That got me so far, maybe 80%, but the extra 20% came from this and then ask oh, right there. Is that it? Cool, okay. So a little more lateral or a little more medial or down towards the spine?
Yeah, right.
Didn't have to guess. She told me. She's like, right there, right there. So if I get tired, because I'm cramped in, I'm using all of this, right? So maybe all I want to do is I want to change it now, because I want to switch arms, because I was using this arm, stabilizing this arm. So then I come in and switch it. Right there. Okay, down. There we go, right there. How's that? And the thing is, it gets to the point where, to me, Thai massage was in the way I looked at it, it was like cockfighting. Like there was no rules. It was just fuck the person up. Like it was a street fight. Like it was like, cause in massage, like I could only use my hands, right? You could only use your hands to do certain stuff. And all of a sudden it was like blood sport, Jean-Claude Van Damme. What's the rules? Throw some sand in a guy's eye, blind him. It's like use dip it resin in glass, you know, yeah. It was like you had more tools, so it's like nobody had to teach me to like use one forearm and then put the other forearm on the shoulder and move it. But the more I interacted with the client, one, the physical space between the two of us just vanished. It was more like I was wrestling with a client on a mat.